Now comes a very interesting field, medical field. So in medical field, robot is actively used nowadays. So there is the topic called as robot assisted surgery. It is actively performed nowadays. So robot assisted surgery, there we can subclassify the robot in the two categories: autonomous robot, where it takes its own decision based on learning, and non-autonomous robot. So these are the non-autonomous robot which are used for surgery. So you can see there are so many robots. Robotic arms are there. I will just show you. There are so many robotic arms are there. Okay, here the doctor is seeing the screen and manually controlling. The controls are given here. Okay, so what happens in case of surgery? Your hand may be shaking, and when hand shakes, it displaces through maybe 1 or 2 mm, and that can create problem in the intricate surgery. Also, when we go with this robot assisted surgery, what is it mean by robot assisted surgery? It is a master slave type surgery. Whatever movement is done by the doctor, same movement is repeated by the robot. Okay. In this robot assisted surgery, we don't need the incision, larger incision. What is the incision means? Incision is a cut. Incision means what? It is a cut made to do the surgery. Okay. So we need the smaller incision here. Okay. So generally robot assisted surgeries are performed in the field of urology, gynecology, heart and lung surgery, and knee surgery, abdomen surgery. There is a particular word for abdomen surgery. Okay, so we need smaller incisions. Okay, because what happens, these are the tubular forms, the robots. Okay, so we make smaller incision, and then we enter particular tube. It may be one tube, two tube, and inside this tube there will be the tools for cutting or stitching, suturing. Okay, so it goes to the small. We have to put a small cut, that is an incision, this device tubes, and it will perform better. Because if you see the benefit, the vision is very, very clear. It is a computerized vision, and we can see very clear, which is not possible when we do personally. Okay, personally it will be without any zoom. Okay, here we can zoom the area, and the vision is very clear. And even your hands are shaking, it will not affect, because we do like in the steering. What happens? When we want to make 1 degree turn, we have to turn a lot of we have to turn the steering through maybe more degrees, 100 degrees, 200 degrees. Same thing is here. So large deflection is converted very small deflection. So we have very precise control over the surgery. Okay. So as the incision is small, recovery is very fast in the robot assisted surgery. So here I am showing one surgery. Please understand, robot itself will not do the surgery. As a surgeon, we have to learn first how to use it effectively, because if you make mistake, it is associated with the human. We can say it is a question of life and death. Okay.
दोस्तों हम देख रहे हैं द विंसी रोबोट सिस्टम। यहाँ पे जो रोबोटिक आर्म रहता है उसको ऑपरेशन कार्ड कहते हैं दोस्तों, और जो सर्जन जहाँ से रोबोटिक आर्म को कंट्रोल करता है उसको सर्जन कंसोल कहते हैं। वहाँ से जो सर्जन रहते हैं वो आर्म्स को एक्यूरेटली कंट्रोल करते हैं। आप देख सकते हैं कि कैसे आर्म कंट्रोल हो रहा है, सर्जन उनको कैसे कंट्रोल कर रहे हैं। आप भली बातें देख सकते हैं दोस्तों। ये द विंसी रोबोट सिस्टम है दोस्तों, जो बहुत बहुत सारी जगह इस्तेमाल होता है सर्जरी के लिए।
So what we have to do is first we have to practice on some other things. So I am showing here the robot, medical robot, Da Vinci, which is used to do incision on the graft, removing its skin. Okay, and skin is to be removed very carefully. So you can see here what skill needed for the doctor. So this is the graft. Now this is a robotic surgery. The doctor is seeing in the screen and then applying its control. You can see very fine incision is taken by the scissor. Very small scissor is there. This scissor will go inside the, if suppose the surgery is inside stomach, it will go inside stomach. Okay. So one control is picking the graft. So see how carefully incision is done. Now they are removing the skin of graft. In such way, we have to practice first on the things which is not a human body. Okay, we have to practice on such thing like here we are seeing the graft. Okay. So doctor is not directly seeing that. Doctor is seeing through the computer. Okay. So it is far away. So benefit of this is that your doctor can see it maybe in India and surgery can be performed in maybe Africa. Okay. So that is possible with the robotic surgery. Okay. Doctor need not to be there. Okay. Only we need the very good internet connection. So see how the perfectly the skin is removed. So this skill is needed by doctor. Okay. So even though robots are available, we cannot directly go and perform the surgery. So surgeon has to make a lot of practice to be efficient. Now, a second thing that is also related with the India telepresence robot. Okay, so there will be robot like this, and they will examine the patients, and the control will be also given to the what is called as physician or doctor. So they can prescribe the medicine based on the symptoms to the patient. Okay, so this is one of the field. Telepresence, it is called as telepresence robot. Then comes a very advanced field, we can say rehabilitation robots. Please understand, robots are also helping the injured people to walk, to assist them in performing some movements that are suggested by physiotherapist. Okay, they also help them to walk. Sometimes there may be some neurological problem, and particular exercise is suggested by the doctors. Okay, so physiotherapists that can be performed with the help of robots. Robots are also used here. Please understand. Then comes medical sanitation and disinfection. So many times, like you can see the knobs of the doors, they are touched by the many doctors, patients, and it to be disinfected where the robot can work. Okay, so we can use either, from the corona's time that we use hydrogen peroxide. Also, there is one way that is a UV, ultraviolet ray. You can see in the photograph. So this robot will move and lead the area with the ultraviolet rays. They stay there for some period and then go. Okay. Now we'll move to the what is called as autonomous robots. Now, when the word autonomous come, then we have to tell about artificial intelligence. So, autonomous robot uses the artificial intelligence. So what is the artificial intelligence is? So it is that technique which makes the robot smarter. Okay, in short, what the robot will able to take their own decision. Like if you see in the program, there will be decision tree will be there, but the decision is written by the programmer itself what to do. But when we say decision is taken by the robot, means what? Its own decision. Okay, it is not told in advance the decision. So in autonomy, the robot will take its own decision based on the situation, based on the training given to the robot. Okay, now there are various we can say the conditions of the intelligence. So we say ability to take the decision, ability to learn, experiment, ability to think, ability to represent the knowledge, ability to think and act rationally, ability to perceive, reason, and plan. So there are various characteristics of intelligence. What is meant by intelligence? If the person goes in a different situation, whether he is able to survive in different situation, that is called as intelligence. Okay, so if you see the characteristic of intelligence, one of the very important characteristic of intelligence is the ability to learn. Okay, so if we want to make machine intelligent, then we have to also make the machine the ability to self learn. Okay, so we have to implement ability to self learn. So that is called as machine learning. So machine will learn from the past experience. So that is called as machine learning. So this is very important aspect of autonomous robot. Now we'll see one autonomous robot, very advanced field, that is the autonomous robot surgery. So we know that we have already seen the application of robotics for the surgery. That type of robot was what? Non-autonomous. So everything was performed by the physician or doctor or surgeon. So it was just following that in the master-slave concept. But in autonomous surgery, what will happen? The robot will perform the surgery itself. That is called as autonomous. Okay. So in autonomous robot surgery, the robot will sense the environment, then will take the decision and perform accordingly. Okay. So there are different levels of autonomy of the robot for autonomous robot surgery. There are 6 levels of autonomy here. The first level, no autonomy, means only the human will perform the operation. Like whatever now robotic surgery are happening is a 0 level. So everything is performed by the surgeon, and the things are just copied by the robot. Okay, so that is 0 level. Then level number 1, the artificial intelligence will help the surgeons to take the decision. Then comes the task autonomy. So we'll give some task autonomy so that robot can do some simple task. Then strategy. In the level 3 autonomy, the robot will tell us the strategy, different strategy. We will select the strategy and accordingly it will perform the surgery. Level number 4 and 5 not yet implemented for surgery. So still it is, we can say, next step. Now go here and see the level number 1. That is the AI will assist the surgeon. So you can see the blue lines are made. Blue lines are made to guide the surgeon and telling the surgeon to make the incision between the 2 lines. Okay, so that is the level number 1 in autonomy. Then level number 2, the simple tasks are performed by the robot, like here, the tumor is cut with the help of robot. Robot will perform all operations. Okay, we'll remove the tumor. Then the highest possible till date is this. That is the level number 3. Here you can see this is the actual photograph of the surgery performed by the robot on the intestinal passage of the 4 peaks. Okay, all this stitching, it is called as suturing in the medical language. This suturing was performed very accurately by the robots. Okay, and the accuracy of suturing was very good. Here in suturing, the each and every stitch is very important. If any stitch is skipped, what happens? The food passage get leaked, and they can create further complications for healing the patient. Okay, so this level we have achieved. We have performed the autonomous surgery for pigs, and it was quite successful. Okay. So this is the level of autonomy we achieve. Maybe in future it will be the full autonomy can be given. So what is the problem with the autonomous surgery? That the surgeon cannot feel the force, or the robot cannot feel the force like the surgeon feels the force, whether it is hard or it is soft. Okay. Also, vision get blurred if the human being is doing surgery. It is difficult to view, but the robot, the vision